This is Stephanie Huff, and I'm recording another concept on thermoregulation. This one is going to be on hyperthermia. An overview of hyperthermia is a body temperature that is above the usual range. There are 4 common types of fevers. There's an intermittent, which is the body alternates at regular intervals between periods of fever and periods of normal temperature. This is commonly seen in some illnesses like malaria. Remittent fevers. These are a wide range of fluctuating temperatures, all of which are above the normal range. This occurs over a 24-hour period and is seen often in colds and influenza. Relapsing fevers. These are short febrile periods that last a few days. They are interspersed with 1 to 2 days of normal temperatures. Constant fevers. They have body temperatures that fluctuates minimally but are always remains above the normal. These can occur in typhoid fever. Fever spikes. These are temperatures that rises to fever levels very rapidly following normal temperatures and returns to normal temperatures within a few hours. You can often see these fever spikes in bacterial blood infections. In some conditions, an elevated temperature is not a true fever. This is seen in heat exhaustion and heat strokes. Your heat exhaustion results from excessive heat exposure and dehydration. Signs and symptoms: paleness, dizziness, nausea, vomiting, fainting, and a moderately increased temperature of 101 to 102 degrees Fahrenheit. A heat stroke is a more serious form of heat exhaustion. It can be life-threatening. Generally, they have been exercising in hot weather. They may have warm, flushed skin. They usually don't sweat anymore. The temperature can be 106 degrees Fahrenheit or greater. They may be delirious, unconscious, or have seizures. You may also see heat cramps, which is a milder form, and usually they come in and have excessive sweating, thirst, and usually have muscle cramps. So here is looking at those heat cramps, and this is severe cramps in large muscle groups, often have sodium depletion due to sweating. This excessive sweating can lead to dehydration and heat exhaustion. So signs and symptoms are going to be nausea, tachycardia, pallor, weakness, profuse diaphoresis. Treatment is going to be rest, getting them out of the hot environment, oral or parenteral replacement of sodium and water. So usually those electrolyte, like sports drinks, like your Propel, Gatorade, those are usually recommended. Sometimes you can give them some IV fluids if they're not able to get enough in orally. You want to provide elevation, gentle massage, and analgesics for the severe cramps. Instructions: when they go home, they need to not perform any strenuous activity for 12 hours, using salt replacement in hot, humid environments. That can be through the use of those sports drinks. Heat exhaustion is prolonged exposure to heat over hours to days. Signs and symptoms: temperature can be 99.6 to 104. They will have fatigue, nausea, vomiting, extreme thirst, feelings of anxiety, hypotension and tachycardia, elevated temperature, dilated pupils. They may have mild confusion. Their skin may be ashen in color, and profuse diaphoresis. Treatment is placing them in a cool environment, removing any constrictive clothing, monitor their ABCs, airway, breathing, circulation. Give oral or IV normal saline, moist sheets over the patient. You can also use fans in conjunction with the moist sheets that will help cool the core temperature. They possibly may need admission to the hospital. Your heat stroke is your most serious form of heat stress. It is a medical emergency. Your signs and symptoms, they'll have an increased temp greater than 104. The skin will be hot, dry, and ashen. They would have an altered mentation, anywhere from confusion to coma. They will also have weakness, hypertension, and tachycardia. Treatment is going to be to stabilize their ABCs, help to reduce their core temperature. A lot of times you will have to use a hypothermic blanket, 100% oxygen. They may need to have a bag valve mask or intubation with mechanical ventilation. Also need to correct fluid and electrolyte imbalances and provide continuous ECG monitoring, and that's due to the loss of electrolytes. So pathophysiology, the clinical signs of fever can vary with onset, course, and abatement stage. This is a result of changes in the set point of the temperature control mechanism, and this is regulated by the hypothalamus. So normally the temperature is near the set point. At the set point, the client will feel neither hot nor cold. They will not have chills. When their normal temperature rises, the rate of heat loss will increase, resulting in a decrease in their temperature towards the set point level. When the normal temperature falls and so becomes too low, then the rate of heat production increases, resulting in a rise of the temperature towards this set point. In a fever, the set point will change rapidly to a higher than normal level. The effects of tissue destruction, pyrogenic substances, or dehydration will ensue. The core body temperature reaches a new set point after several hours, and you will see the normal responses that occur with increased temperature, like chills, feeling cold. They may have cold skin initially due to vasoconstriction and shivering. That's known as the chill phase. When the core temperature reaches this new set point, the patient doesn't feel cold nor hot and no longer has chills. And then that is when they enter what's known as the plateau phase. Very high temperatures of 106 to 108 can actually damage the parenchyma of the cells throughout the body, especially in the brain, where the neuronal cells are destructed, and these becomes irreversible. Once the cause of the high temperature is removed, then the set point of the hypothalamic thermostat is reduced. It may even be back to the normal set point level. So at this point you will see excessive sweating, hot flushed skin from vasodilation. This is known as the flush phase. In response to infections, macrophages release endogenous pyrogens, and this causes the fever to occur. In looking at malignant hyperthermia, this is a frequently inherited reaction to inhaled anesthetic as well as acetylcholine. We kind of talked about this a little bit in the concept of thermoregulation. It can develop during surgery in the OR, or it can develop in the PACU, which is the post-anesthesia care unit. So you're wanting to watch for client signs and symptoms. If they are left unchecked, then the reaction will progress. There is a medication called dantrolene sodium, and it is a muscle relaxant, and it will, if it is given IV push, it can prevent death from occurring. It can also be repeated every 4 to 6 hours until the signs and symptoms resolve. There is testing available to find out if somebody's at risk for malignant hyperthermia. So your early symptoms of malignant hyperthermia are going to be an escalating temp and increased carbon dioxide production. The nurse should immediately administer 100% oxygen with a non-rebreather mask. stay with the client, ensure good IV access, and summon the anesthesia provider to let them know about the findings. You also want to employ measures to decrease the core body temperature. Some things that they will do is going to be to insert a Foley and monitor urinary output. They will draw blood for testing, ABGs to measure the pH. They can give sodium bicarbonate to correct the metabolic acidosis. Insulin is given to decrease their serum potassium levels. Looking at the etiology, fevers can occur in response to infections. These can be viral or bacterial. Many occur in response to tissue breakdown, such as following an MI, with malignancy, surgery, or trauma. Your risk factors, they usually have a diminished immune response, which increases the risk for infection. Children in daycare, they usually haven't developed an immunity to common diseases of childhood yet, and so once they start daycare, they will come home and have lots of infections, whether it be common colds, ear infections, strep throat, things like that. Looking at prevention, vital signs are only one piece of necessary data that needs to be collected. You want to make sure that you are monitoring these vital signs at regular intervals. They usually graph the data to become aware of a pattern and trend in their temperature and their changes over time. Your clinical manifestations, these are signs and symptoms that are common in all fevers. So you may have flushing, skin that is warm or hot to touch. They will have an increased metabolic rate that results in the increased need for fluids. You may also see tachycardia and tachypnea, fatigue, malaise, weakness, decreased responsiveness, difficulty concentrating, and a skin rash. You may also see poor appetite, vomiting and or diarrhea, and body aches. A lot of times parents get really upset because their child is not eating, and I have to remind them that even adults, when they don't feel good, we don't feel like eating as much. But the important thing is to make sure that they are drinking plenty of fluid so they do not get dehydrated from those increased fevers. Treatment is not always indicated for fevers. It can be a beneficial response to help slow the bacterial growth in the body. Fevers are not inherently harmful until they reach 41 degrees Celsius or 105.9 degrees Fahrenheit. So sometimes they may not treat, or they may postpone treatment for some of the low-grade fevers. Your acetaminophen and ibuprofen are your preferred antipyretics for children. Aspirin is no longer recommended or given to children due to the risk of development of Reye syndrome. Antibiotics are administered for infectious diseases. Antibiotic is responsible for decreasing morbidity and mortality from infections. There are some resistant strains of bacteria, so you have to kind of be aware of that when you're prescribing antibiotics. Lifespan and cultural considerations. Febrile seizures are generalized seizures that are usually seen in children as a result of a rapid temperature rise above 102 rectally that is associated with acute illness, and it's usually not how high the temperature gets, but how fast the temperature rises is what causes the febrile seizures. They are usually seen in children between the ages of 6 months and 5 years, with the peak being in the toddler years. Fever and culture. So fever can be viewed differently by various cultures. There is what's known as a hot and cold theory. And so fever is a hot condition, and so they treat it by giving cold substances with foods or medications. Some of your cold foods are considered to be vegetables, fruits, and fish. Your cold medications include orange flower water, linden, and sage. Collaboration is going to revolve around the underlying cause of the fever. Children with a history of febrile seizures, the nurse from the pediatrician's office will collaborate with the parents and the classroom teacher to ensure that the staff knows what to do in an event of a febrile seizure. Also, how to prevent the onset of febrile seizures, and that's through the use of adequate hydration, access to refrigerated fluids, shortened recess periods outside in the hot weather, and having access to shade. In the nursing process, looking at the assessment, you want to assess their hydration status and fluid intake, assess vital signs, comfort level, and appetite. You want to observe for seizures and a toxic appearance, and this is especially in children. Toxic appearance is described as lethargy, poor perfusion, hypoventilation or hyperventilation, and cyanosis. Patients with fevers tend to be irritable, restless, and have fitful sleep. They may also have some nonspecific muscular pain, and so anytime that you have a fever, you just kind of feel kind of achy all over, and that's kind of what those nonspecific muscular pains are. You want to identify your high-risk clients, so your infants and children with toxic appearance, your neonates under 28 days with a temperature of 100.4, children under 4 years of age with a temperature of 105.8, children with other conditions such as children that have a VP shunt, for hydrocephalus, if they have congenital heart disease or sickle cell disease, your immunosuppressed clients, so maybe they've undergone chemotherapy or had an organ transplant, or they have HIV or AIDS. Your chronic conditions are going to include diabetes, congestive heart failure, and pulmonary diseases. You also want to observe for other signs of infections like rashes, nausea, vomiting, or diarrhea, generalized symptoms of poor appetite, and malaise. These are your named nursing diagnosis for fevers. In planning, goals may include that the client will have a temperature that approaches normal limits within 60 minutes of giving an antipyretic. They will have a temperature that remains within normal limits within 48 to 72 hours of beginning antibiotic therapy. They will also maintain a temperature within acceptable limits within 4 hours of application of a hypothermia blanket. Patients or caregivers will describe temperature elevations that needed to be reported to the healthcare provider immediately, and they will also recognize symptoms requiring consultation with the healthcare provider. In implementation, you want to support the body's normal physiological processes, provide comfort, and prevent complications. You want to monitor their temperature and other vital signs every 2 hours. Promote adequate fluid and nutritional intake, monitoring intake and output. You can apply ice bags covered with towels to the groin. You will also see them place them around their neck and the axilla, and that will actually cool their core temperature down pretty quickly. Making sure that you're covering the client with only a sheet. They usually tend to ask for lots of warm blankets, but the more that you bundle them up, the higher their temperature is going to elevate. Care in the community, home care. You want to teach parents to care for the children with fevers at home. Also teaching them how and when to give antipyretics. A lot of times you have to give them how much, what the dose is going to be, because many parents will under medicate their children's temperatures. Situation of caregivers being scared about negative results has been labeled as fever phobia, and there's a correlation between lower educational level and heightened concerns about fever. A lot of times they are worried that because their child has a fever that they may develop seizures, they may have some brain damage, or they may even die. Usually fevers and this fever phobia tends to be higher regarding younger children, so the younger the child is, the more concerns and fears that the parents have. In evaluation, expected outcomes may include that the client's fever is effectively managed with antipyretics, the client maintains adequate hydration as evidenced by skin turgor, moist mucous membranes, sufficient urinary output, and a hematocrit within normal range. So some questions. It is the summer season and patients with signs and symptoms of heat-related illness present to the ED. Which patient needs attention first? 1. An elderly person complains of dizziness and syncope after standing in the sun for several hours to view a parade. 2. A marathon runner complains of severe leg cramps and nausea, tachycardia, diaphoresis, pallor, and weakness are observed. 3. A previously healthy homemaker reports broken air conditioner for days, tachypnea, hypotension, fatigue, and profuse diaphoresis are observed. Or 4. A homeless person, poor historian, presents with altered mental status, poor muscle coordination, and hot, dry, ashen skin, and the duration of exposure is unknown. Okay, so if you picked 4, that is correct. 1 could be heat exhaustion. The second one, that is somebody that has heat cramps. The third one is heat exhaustion as well, still sweating. And then 4, we don't have a lot of information. We don't know the extent of the exposure, but their skin is now hot, dry, and ashen. They have altered mental status and poor muscle coordination, and these are signs and symptoms of a heat stroke. So that's why that patient needs to be seen first. All right, so that is the end of hyperthermia. And as always, if you have questions, let me know and I will try to help clarify.